Have you ever taken a pill, thinking it would make you feel better, only to wonder what hidden damage it might be causing to your body? You trust your medications, don't you? But what if I told you that some of the most common drugs out there could silently harm one of your body's most vital organs? Yes, I'm talking about your kidneys, the unsung heroes that work tirelessly to filter your blood and keep you alive. In this video, I'm about to reveal 10 common medications that could be damaging your kidneys right now. Medications that might even be in your cabinet as we speak. Stay with me, because this might just save your life or the life of someone you care about. The silent threat begins. Kidney damage doesn't happen overnight. It creeps in quietly, without warning. Over-the-counter painkillers, antibiotics, and even heartburn medications, everyday drugs we trust, could be putting your kidneys at risk. NSAIDs, like ibuprofen, are a prime example. Taken too often, they reduce blood flow to your kidneys, slowly wearing them down. Heartburn meds, like omeprazole, aren't harmless either. Studies link long-term use to kidney disease. And let's not forget antibiotics, life-saving but capable of causing severe kidney stress if misused. Why this matters? Your kidneys work hard every day to keep you alive, but they're vulnerable. Protecting them starts with knowing the risks. So, the next time you reach for a pill, think twice. If this video made you pause, share it with someone who needs to know. And don't forget to hit subscribe, because your health is worth protecting and knowledge is the first step. Kidney damage doesn't happen overnight. It creeps in silently, without obvious symptoms. And by the time you realize something's wrong, it could already be too late. So whether you're on these medications or know someone who is, it's crucial to understand the risks. Let's dive into the 10 medications that can harm your kidneys, starting with a common household staple that most people don't think twice about. Number 1. Over-the-counter painkillers, the silent culprit. First on our list are over-the-counter painkillers like ibuprofen, naproxen, and even high doses of aspirin. These drugs, known as NSAIDs, or non-steroidal anti-inflammatory drugs, are everywhere. They're the go-to solution for headaches, back pain, or any minor discomfort. Sounds completely harmless, doesn't it? But here's the hidden danger. NSAIDs work by reducing inflammation, but they also reduce blood flow to your kidneys. Over time, this strain can lead to chronic kidney damage, especially if you take these medications frequently or for extended periods. The damage is slow, silent, and often irreversible. Now think about this. Millions of people around the world pop these pills daily, completely unaware of the risks. Are you one of them? Are these painkillers a part of your daily routine? The worst part is kidney damage doesn't come with obvious warning signs. It creeps in silently, and by the time symptoms show up, it might already be too late. It's not just about avoiding painkillers. It's about understanding the risks and using them responsibly. If you rely on NSAIDs for chronic pain or minor aches, it's time to rethink how often you use them. Could there be safer alternatives? Maybe a conversation with your doctor about other options. Your kidneys are precious. They're the silent warriors of your body, and they deserve your care. So, the next time you reach for that painkiller, think about the long-term impact it could have. If this information surprised you, share it with someone who needs to know. And don't forget to subscribe for more life-changing insights. Your health is worth protecting, and knowledge is the first step. Number 2. Antibiotics. A double-edged sword. Next on our list are antibiotics. These drugs are nothing short of miracles when used correctly. They can fight off severe infections and save lives. But here's the hidden truth. Some antibiotics can be dangerous for your kidneys. Take aminoglycosides, for example. These are commonly prescribed for severe infections. While they're effective, they're also nephrotoxic, a complicated way of saying they're toxic to your kidneys. Even more commonly used antibiotics, like penicillin or sulfonamides, can cause harm if not used properly. Here's why this happens. Your kidneys are responsible for filtering out these drugs from your bloodstream. But in the process, they can experience stress and damage. It's like asking someone to clean up a constant mess. It wears them down over time. The scariest part: many people misuse antibiotics. They take them without a prescription, don't finish their prescribed course, or use them for illnesses that don't even require antibiotics, like the common cold. Every misuse increases the strain on your kidneys, and the damage could add up before you even notice. This is why it's absolutely critical to only take antibiotics when they're genuinely needed, and always under a doctor's guidance. Misusing or overusing these drugs might leave you with more problems than you started with, and your kidneys could end up paying the price. Number 3. Heartburn medications. The surprising risk. Is something you might not expect. Heartburn medications. Yes, those little pills you take for acid reflux or stomach ulcers, like omeprazole and lansoprazole, commonly known as PPIs or proton pump inhibitors. They're often seen as harmless and are even available over the counter in some places. But the reality is far more complicated, and it's something you need to know. Studies have uncovered a disturbing link between long-term use of PPIs and chronic kidney disease. You might be wondering, how can something designed to relieve discomfort harm your kidneys? Let me explain. PPIs work by reducing the production of stomach acid. This helps with acid reflux and ulcers, but it also disrupts the delicate balance in your body. Over time, these drugs may cause inflammation in the kidneys, a condition called interstitial nephritis. If this inflammation goes unchecked, it can lead to scarring and permanent damage to the kidney tissues. The most alarming part is that kidney damage from PPIs often develops silently. There are no obvious warning signs at first. You could be taking these medications for months or even years, believing they're helping you, while in reality, they might be slowly harming one of your body's most vital organs. So, what can you do? First, don't panic. If you're taking PPIs, it doesn't mean you're destined for kidney problems. But it does mean you should be cautious. Talk to your doctor about your options, especially if you've been on these medications for a long time. There are alternative treatments, and in some cases, lifestyle changes like adjusting your diet can significantly reduce the need for these drugs. Your kidneys work tirelessly to keep you healthy, but they're vulnerable. Protecting them starts with awareness. If you're relying on PPIs regularly, it's time to take a closer look at the risks and discuss safer options with a healthcare professional. If this information surprised you, share it with someone who might need to hear it. Don't forget to subscribe for more life-changing insights, because your health is too important to ignore. Number 4. Diuretics. The water pill dilemma. Now, let's talk about diuretics, commonly known as water pills. These medications are often prescribed for people with high blood pressure or heart failure. They work by helping your body get rid of excess water and salt, which reduces the strain on your heart and blood vessels. Sounds helpful, doesn't it? But here's the part no one tells you. Too much of a good thing can sometimes turn into a serious problem. Here's why. When you take diuretics, your kidneys work overtime to flush out the extra fluid. But if you lose too much water, your body can become dehydrated. And dehydration, it's one of the worst enemies of your kidneys. Without enough fluid, your kidneys struggle to filter waste from your blood. Over time, this strain can cause kidney injury, something that can silently build up until it becomes a major issue. The scariest part is that this risk often goes unnoticed. People assume water pills are completely safe because they're prescribed by doctors. And while they are effective when used correctly, excessive or long-term use can lead to problems. Symptoms like fatigue, dizziness, or muscle cramps might be signs that your body is losing too much water and salt. Think about it. Your kidneys are like a filter. They need a proper balance of water and electrolytes to function. When you disrupt this balance, even unintentionally, it can have long-term consequences. So, what can you do? First, never self-medicate with diuretics. If you're taking them as part of your treatment, follow your doctor's instructions carefully. Keep an eye on your hydration levels and watch out for warning signs like dry mouth or dark urine, both of which can indicate dehydration. Your kidneys are hardworking and resilient, but they're not invincible. Protecting them starts with understanding the risks and using medications responsibly. If this information resonated with you, share it with someone who might need to hear it. And don't forget to subscribe for more life-saving insights. Remember, your health is precious, and small changes today can protect you in the long run. Number 5. Cholesterol-lowering drugs, the statin story. Let's talk about statins, those cholesterol-lowering drugs that millions of people take every day. If you're on statins, you're certainly not alone. These medications are often essential for managing high cholesterol and reducing the risk of heart disease. But here's something you may not know. While statins can be life-saving, they're not without risks that could silently affect your kidneys. One of the rare but serious conditions linked to statins is called rhabdomyolysis. It's a big word for something quite alarming. In simple terms, rhabdomyolysis happens when muscle tissue breaks down and releases substances like myoglobin into your bloodstream. While this might not sound dangerous at first, myoglobin can overwhelm your kidneys as they work to filter it out. The result? Kidney damage that can range from mild to severe. Now, you might be wondering, is this common? The truth is, the risk of developing rhabdomyolysis from statins is low. But if it happens, it can be devastating. The symptoms to watch out for include unexplained muscle pain, weakness, or even dark-colored urine. If you're experiencing any of these while taking statins, don't ignore them. It's your body's way of signaling that something might be wrong. Why is this important? Because statins are so widely prescribed that people often take them without giving much thought to potential side effects. And while the benefits often outweigh the risks, being aware of the signs of complications can make all the difference. If you're on statins, talk to your doctor about your dosage and any symptoms you've noticed. Sometimes, even small adjustments can reduce risks without compromising the benefits. Your health should never be left to chance, especially when it comes to your kidneys. Number 6. Laxatives. More harm than relief. Let's talk about something that seems completely harmless: laxatives. They're often used to relieve constipation or help with digestive issues, and most people think they're perfectly safe. But what if I told you that frequent use of laxatives could silently harm one of your most vital organs, your kidneys? Here's the hidden truth. Not all laxatives are created equal. Some, especially phosphate-containing laxatives, can be particularly dangerous. While they might give you quick relief, they can also come with serious risks that most people aren't aware of. When you use laxatives too often or in high doses, they can disrupt the delicate balance of electrolytes in your body. Electrolytes, like sodium, potassium, and calcium, play a crucial role in your body's overall function. When these levels become imbalanced, your kidneys are forced to work harder to restore that balance. Over time, this extra strain can weaken them. But that's not all. Excessive laxative use can also lead to dehydration, another major enemy of your kidneys. Your kidneys rely on adequate hydration to filter waste and toxins effectively. When you're dehydrated, they struggle to perform their job, increasing the risk of long-term damage. The most alarming part is that many people use laxatives habitually, believing they're a quick and harmless fix. Some even rely on them regularly without realizing the potential consequences. If this sounds familiar, it's time to take a step back and reconsider. So, what can you do? If you find yourself reaching for laxatives often, it might be worth exploring safer, more natural options. A diet rich in fiber, drinking plenty of water, and staying active can help improve digestion and reduce the need for laxatives. And if you're dealing with chronic constipation, consult a healthcare professional. They can help you find solutions that won't harm your kidneys. Your kidneys work silently to protect you every day, but they can only do so much. Protecting them starts with the choices you make. If this information opened your eyes, share it with someone who might need to hear it. And don't forget to subscribe for more insights like this. Your health is worth it. Number 7. Chemotherapy drugs, the hidden cost of treatment. Let's talk about something that is both life-saving and life-altering: chemotherapy. These treatments have given hope to millions of cancer patients around the world. But as powerful as chemotherapy drugs are, they come with hidden risks, especially to your kidneys. Drugs like cisplatin and methotrexate, commonly used in chemotherapy, are known to be harsh on the body. While they target cancer cells, they can also cause direct damage to kidney cells, leaving your kidneys vulnerable. Why? Because your kidneys are responsible for filtering these drugs out of your system. The process can overwhelm them, leading to potential injury or long-term damage. But that's not the only problem. Chemotherapy often comes with side effects like severe nausea and vomiting, which can lead to dehydration. And dehydration, as you may already know, is a major enemy of kidney function. Without enough fluids in your system, your kidneys struggle to do their job, increasing the risk of complications. Now, if your loved one is undergoing chemotherapy, this might sound alarming. But here's the good news. There are steps you can take to minimize these risks. Staying hydrated is key. Drinking plenty of water helps your kidneys flush out toxins and medications more effectively. Your healthcare team may also recommend additional fluids through an IV to protect your kidneys during treatment. It's also important to have regular kidney function tests. These can help monitor how your kidneys are handling the chemotherapy and allow for adjustments in your treatment plan if needed. While chemotherapy is a necessary part of many cancer journeys, understanding its impact on your kidneys is crucial. Being proactive about hydration and working closely with your healthcare providers can make all the difference. Your kidneys are your silent protectors, but they need your care, especially during something as challenging as chemotherapy. If this information resonated with you, share it with someone who might need to hear it. And don't forget to subscribe for more life-saving insights. Knowledge is power, and when it comes to your health, it can truly be the difference between hope and hardship. Number 8. Herbal supplements, not always safe. Here's something that might surprise you. Herbal supplements, the ones you might think are safe because they're natural, can sometimes be dangerous for your kidneys. Yes, the same products marketed as harmless and healthy alternatives could be silently causing harm to one of your body's most vital organs. Let's break it down. Just because something is labeled as natural doesn't mean it's risk-free. Take aristolochic acid, for example. This compound is found in certain traditional remedies and has been shown to be highly toxic to the kidneys. The damage it causes is severe, often irreversible, and can even lead to kidney failure. But it's not just rare herbs you need to watch out for. Even common supplements, like vitamin C, can pose risks if taken in high doses. Excess vitamin C can lead to the formation of kidney stones, small but painful deposits that can block your urinary tract and strain your kidneys. The problem is, many people assume herbal supplements don't require the same caution as prescription drugs. They're sold over the counter, marketed as safe, and often used without consulting a doctor. But here's the truth. Supplements can interact with other medications you're taking or exacerbate existing health conditions, including kidney issues. The key to protecting your kidneys is awareness and moderation. Before adding any herbal supplement to your routine, ask yourself, do I really need this? Is it safe for my body? Better yet, consult a healthcare professional. They can guide you on what's safe, what's not, and what dosage is appropriate for your specific needs. Your kidneys are resilient, but they're not invincible. They work silently to filter out toxins every single day, and the wrong supplement can put unnecessary strain on them. If you've been relying on supplements without a second thought, it's time to reconsider. Share this video with someone who might need to hear this. And don't forget to subscribe for more life-changing insights. Remember, protecting your health starts with informed choices, and your kidneys deserve nothing less. Number 9. Antidepressants. Balancing risks and benefits. Let's talk about something that often goes unnoticed: antidepressants. For many people, these medications are a lifeline, offering relief from mood disorders like depression or bipolar disorder. But what if I told you that some of these drugs, especially lithium, could have serious long-term effects on your kidneys? This is something most people aren't aware of, and it's vital to understand. Lithium is a common and highly effective treatment for mood disorders, but it comes with a hidden cost. Over time, lithium can affect how your kidneys function. In some cases, prolonged use can lead to chronic kidney disease, a condition where your kidneys gradually lose their ability to filter waste and toxins from your blood. How does this happen? Lithium requires close monitoring because it can build up in your bloodstream if not managed carefully. When lithium levels get too high, it can become toxic to your kidneys, causing damage that might not show symptoms until it's too late. And unlike some side effects that go away when you stop a medication, kidney damage is often permanent. But here's the thing. This doesn't mean you should stop taking lithium or any other antidepressant prescribed by your doctor. These medications save lives, and their benefits often outweigh the risks. The key is awareness and monitoring. If you're on lithium, regular kidney function tests are an absolute must. These tests can detect early signs of kidney stress and allow your doctor to adjust your dosage or explore alternative treatments if necessary. Staying hydrated and following your doctor's instructions can also reduce the strain on your kidneys. Your mental health is incredibly important, but so is your physical health. You shouldn't have to choose between the two. By staying informed and proactive, you can strike the right balance and protect your kidneys while managing your mental health. Number 10. Antiviral drugs. Fighting one battle, risking another. Let's talk about something that might not be on your radar: antiviral drugs. These medications are often life-saving, helping people manage conditions like HIV, herpes, or other viral infections. But what if I told you that some of these powerful drugs could silently harm your kidneys? It's a side effect many people don't see coming, and it's something you need to be aware of. Drugs like tenofovir and acyclovir are commonly prescribed antivirals. While they are incredibly effective at fighting viruses, they can also put a heavy strain on your kidneys. Why? Because your kidneys are responsible for filtering these medications out of your body. When taken in high doses or without proper hydration, these drugs can overwhelm the kidneys, leading to potential damage. In some cases, these medications can cause a condition called acute kidney injury, where the kidneys suddenly stop functioning properly. Over time, repeated stress from these drugs can even lead to chronic kidney issues. The worst part: this damage often happens silently, without obvious symptoms, until it's too late to reverse. But don't panic. If you've been prescribed antiviral medications, it doesn't mean you're destined for kidney problems. The key is prevention and awareness. Staying hydrated is one of the simplest yet most effective ways to protect your kidneys. Drinking plenty of water helps your body process and eliminate these medications more efficiently, reducing the strain on your kidneys. It's also important to communicate openly with your doctor. If you have a history of kidney problems or notice any unusual symptoms like swelling, fatigue, or changes in urination, bring it up immediately. Your doctor can monitor your kidney function with routine tests and adjust your treatment plan if needed. Your kidneys are silent protectors, working around the clock to keep your body in balance. But they need your care and attention, especially when you're on medications like antivirals. Your kidneys are your silent protectors. Every day without rest, they filter your blood, balance your fluids, and remove toxins from your body. They are vital for your survival, yet so often overlooked, until something goes wrong. But here's the truth: your kidneys are vulnerable. The very medications you take to feel better could be silently harming them. And by the time symptoms appear, the damage might already be done. Now that you understand the risks, it's time to reflect. Are there small changes you can make today to protect your kidneys? Could this knowledge save someone you care about? Remember, prevention is always better than cure. Your health is in your hands. Don't take it for granted. If this video opened your eyes, don't keep it to yourself. Share it with someone who might need to hear this. And if you want to stay informed about life-saving health tips, hit the subscribe button and turn on notifications. Because here, we're not just sharing information. We're helping people take control of their health, one step at a time. Your kidneys deserve your care. Start today.